Hey, everybody. Welcome back to Keeping It Spiritually Simple. I'm your host, Sandra McEllis. And before I introduce my guest, I'd like to ask each and every one of you, no matter what platform you're on, to please like, subscribe, share, leave us a comment, because it really helps these videos, circulate in the algorithm that's invisible to me. But every time somebody hits something, the video rotates in a way that it comes back out, and we're hoping that it lands in front of someone that it can really help them, that they really need to hear what it is we're about to talk about. And if you want to put faces with a voice, head over to YouTube, Sandra McEllis. And then, of course, always in the description will be our guest links. And if you want to know more about Dr. Monique, who I'm about to introduce, there is an intro video that will be put out first. So if you want to know a little bit more about her personal details and so on, I suggest you head over to that video. So, hello, Dr. Monique.
Hello.
How are you today?
I cannot complain. I'm doing well. How about you?
Well, I always believe every day you get up is a day to start, doing what it is you need to do and what is driven to keep you happier, healthier, alert, aware, but in the present moment to work through what presents, because life is a lesson. That's how I view it. So, your title, neuropsychometrician. Now, when I first met you and you began to explain what this was, it was like, unknown information. Warning, warning. I have no clue what she's saying. But as I told you, I worked through my first line of communication, which is my feelers. And my feelers were trying to just transcribe what you were saying. And I was like, oh, is that kind of like functional medicine who gets to the root of issues, but it's in the mental health arena? And even then, I don't think I was giving it enough of a description. So, could we please tell our viewers what it is that you do with this title of a neuropsychometrician?
Okay. I get this question a lot because a lot of people haven't heard about it. Some people have heard of the term psychometrist and psychometrician. A psychometrist is the person who actually does the testing when we're doing evaluations and assessments. They actually do the testing working directly with the patient. They do the test score and administration. The psychometrician can do the same thing. However, there's two aspects to being a psychometrician. So as a scientist, they can help with the development of tests and assessments. They also deal with that side of it and overseeing those processes and working with other scientists and maybe educational professionals or other mental health professionals to build testing assessments for like what you would see on like Pearson assessments, school assessments, like standardized testing, things of those natures. So that's what psychometricians do participate on one side of the house. On the other side of the house, psychometricians, the difference between them and a psychometrist is they have a doctorate. So they can actually order tests, they can administer tests. They also look at the validity and reliability of those tests when they're administering them to individuals. So that's basically a broad overview of the difference between the psychometrist and the psychometrician. However, a neuropsychometrician takes it a little bit further, not only doing testing and evaluations and checking for the validity and reliability of those tests and assessments that are administered, they're also looking at the brain functioning, cognitive performance. So neuropsychometricians are literally focusing on neuropsychological evaluations, brain functioning, cognitive performance, memory loss, attention issues. And that's basically the difference really between the two. So it does take another level of education. Those who want to focus on the neuro side need to have a neuro background. Like, for example, I did like a postdoctoral background in neuro, doing neuropsychological evaluations. And it could be on the cusp if you want to be licensed as a clinical neuropsychologist, which is different because they're licensed. Neuropsychometrician is not licensed, they're just a clinical scientist. So that's really the difference between the two.
So, with that degree, what type of clientele would come to you and why? Like what would be happening that give some examples of who would walk through your door?
So the majority of the people who actually walk through my doors, anybody who has like a neurodevelopmental or neurocognitive disorder. So on the neurodevelopmental side, it would be like intellectual disability, ADHD, any type of communication disorder, autism, movement disorders, language disorders, and specific learning disabilities. So that's neurodevelopmental because that's the stages of development of a human being, right? So when we're younger, we're going through our stages of development. So if you encounter any type of brain dysfunction or cognitive impairment at the stages of development, it's called neurodevelopment. Now, once you're already an established adult and you suffer from any type of neuro injury, like a traumatic brain injury, a concussion, or any type of injury that might be medically related, like say dementia, then you would come for me to get an evaluation too. And that's what we call neurocognitive disorders. Like those disorders are throughout life and they happen based on some type of injury to the brain.
Okay. So that includes car accidents, that includes, falls, that includes head injuries from, a work injury or
Sports
abuse,
injury.
sports injury. Um, what other kinds of things would bring people to you for traumatic brain?
So
Would it be some kind of trauma? Could it be
it could be trauma
emotional
too.
trauma?
It can be emotional trauma. I also deal with individuals, not just on the neuro side. I have seen people who suffer from mood disorders like bipolar disorders, personality disorders, schizophrenia, and psychotic disorders. I mean, you just about name anything in this book right here is really who I see, except for a few that I don't see. But for the majority, it'd be personality, anxiety, mood, depression, neurocognitive, neurodevelopmental, and even cultural issues that affect cognitive performance. I've seen people for that too.
So, do parents bring their children to you?
I've worked with children as young as 5 and adults as old as about oldest adult was 75.
Wow. So was the 75-year-old more because of a traumatic brain injury type thing, or was it a dementia, um, you know,
Interestingly
cognitive
enough,
decline?
the person that was seeing me was having some memory and attention issues. And when I first seen them, they were quite okay, you know, just it's just like some memory issues. But then when I started asking questions, I realized the individual spouse had passed and they were together for over 4 decades. So can you imagine
Mm.
your life when someone passes away? Like you're not going to be in the right headspace. You're not going to have be focused, be able to pay attention. So at first I thought it was pseudo dementia. But with pseudo dementia, people are aware that they have memory problems and attention problems. And they like, I think I have dementia because I notice I have this decline. I can't remember, and I'm irritated. With pseudo dementia, people are aware of what's going on with them. With dementia, they're not aware of what's going on with them. So at the time, the person was not aware, but their family members were, and the family members referred. And so over time, it was like a 6 month period between the first time I saw the person and then when they were able to be tested. And I saw the significant decline in that 6 month period. And I was quite concerned. I was thinking maybe it's such major depression where they don't want to even do their daily
Mm.
functioning, like check and balances, being able to, dress themselves and do their daily activities. But the more I saw in the testing and the scores, the more I knew it was a cognitive decline and end up diagnosing that person with the unspecified neurocognitive disorder related to dementia because there's other things that have to be factors in. You can't just diagnose somebody with dementia as a clinical mental health professional like me, they have to see a medical provider. So they have to look at the history to see if the certain gene factors are hereditary. They have to, do their annual physical examination too. They have to see a neurologist. They have to get an MRI. So neuroimaging is a component. So I could just say, oh, this person has dementia, diagnose them. This person has unspecified, but now you need additional medical treatment to determine if it's going to be definitive or not. So that was the case with my oldest patient that I saw.
Well, I'm listening to all of this and I'm thinking to myself, I think, well, first of all, we need a lot more awareness to mental health, period. So I want to give that shout out. And the specialties that you are in, I think, are very unique and need to be shared with more and more people to understand that there are other alternatives than a basic going to a doctor and getting a prescription and seeing if something works. There are additional testing that can hone in
Mm-hmm.
to specifics that maybe allopathic or primary cares are bypassing.
Mm-hmm.
But I do notice that a lot of other, because it's become more prevalent with Alzheimer's and dementia right now, right? And we don't necessarily know what's causing it, but a lot of people, like in their, when they get into their 50s or 60s and they start seeing memory or this or that, I think a lot of it for me personally is because I have worn a badge of honor that multitasking
Mm-hmm.
was a superior way of being. If I could do 3 or 4 things at one time, I was mastering something big. But what I'm finding now is that's actually a hindrance. And it's almost like tasering my brain and my nervous system because nothing ever gets to come to completion within what I want to call my neural pathways. So
Mm-hmm.
even though, you're doing multiple things. So I think many people can be masking what's going on because of some of the programming and behaviors that they've adapted to
Mm-hmm.
in their life. Does that have any factor on some of the things that people come to you for? It's just their
It does.
behavior and their, okay.
It does. And the question to that would be, is it actually multitasking if you're not completing a task? It's multitasking when you complete those tasks. And I see a lot of that in those with ADHD. And the primary complaints when they see, I think I have ADHD, that will be number one. I can't multitask. If I attempt to do so, they kind of leave that one task behind, focus on this one, then get distracted by another one. So they don't finish the second one. They move on to the third one. They might finish the third one, but they don't go back to the first or the second. That's always the problem. Or being able to have that selective attention. Like you're talking to me right now, but you can hear me say something else in the background, or somebody else say something in the background. Or as I'm talking to you right now, I can talk to you and hear that my air conditioner is playing, but it's not distracting me to where I'm like, oh, Sandy, hold on. I can't hear you because I'm distracted by the air conditioner. I can still talk to you and be able to have a conversation and then know that it just went off like just right now.
Mm-hmm.
So when I'm talking to people, those would be like the memory issues, like, yeah, I can't remember to do this or that. I have to write everything down. There's some people that have to write everything on a post-it note to remind the daily tasks they have to do. And it might even be work related too. They might have to write down everything they have to do for work. Some people are in trouble about that, performance issues. So they're constantly writing everything down and then relying on that list to get things done. And if they don't have the list, they're frantic. So a lot of issues that surround memory, attention, complex attention, sustained attention are like the dominant issues that I see when I'm dealing with people.
Yeah, and then that franticness just leads to the overabundance of
Anxiety.
cortisol, which creates the anxiety, which creates digestive issues, which creates
Hmm.
microbiome of the gut, which creates, going off, which
Yeah.
creates, tightness in the scalene, so you're not breathing, Totally. And, the list goes on and on, physically, mentally, emotionally, they all
Hmm.
go hand in hand. And I don't
Right.
think that we're looking at it in that way, because when we go to, standard medical care, they're looking at one thing and
One
trying to
thing.
work on the one thing.
Hmm.
Whereas you're bringing in the gamut and
Hmm.
listening to all of it,
Everything.
that, and then having these tests that say someone else may not know anything about. Because let's face it, most that get out of medical school that maybe go into one specialty or another, but we're mostly going through our primary care, they don't have any clue. But the insurance companies are saying, we need you to treat more of these people, we
Hmm.
don't want you to send them out to specialists, try to handle it in house, right? And so their scope of awareness and knowledge is very limited. But if someone was to get into the hands of, say, your office and your hands, then I think they have, um, smorgasbord of choices that you could choose from to narrow some things down. That, it's like we talked about one day. Um, People will go to therapy over and over and over again, and the therapy just isn't doing.
Isn't
I don't
working.
understand, I've been doing it for years, I guess I'm not curable, it's not working, it must be me, something's wrong. And it could be that that particular type of therapy is not zoned in on what is
Hmm.
going on mentally,
Right.
that is coming out in behavior or habits, or displayed to the world. So we need to do more internal work and take a closer look at the functions of the brain.
Right. Exactly. You hit the nail on it. Literally what I do is that it's a whole all-encompassing situation of the person. I'm not just looking at psychological and psychiatric histories. I'm looking at medical, social. I'm looking at your family background. Is there a history of this? Because we all know genetics play a major factor. If your parents suffered from depression, at least one of them, the chances of you having depression is much higher. So when somebody comes in and say, I think I have ADHD, and they list all the problems that they have, and then I say, hey, have you ever been exposed to trauma? Yes, I saw somebody get murdered right in front of my eyes and never went to therapy for it, never was treated for it, but they think they're fine, but they don't know something that affected them years back will come and creep and affect them later.
Mhm.
Now you realize you have this phobia of being outside alone. You don't want to go, outside at night. So then that, impels on your social relationships with people because you're not socializing, you're not going out and all of these things. And then certain things might trigger you to where you can't pay attention and you're thinking it's ADHD, but it might be PTSD
Yes.
based on what, so it's things like that. That's why I asked all those questions. That's why any psychologist that does testing or, psychometrician, whoever, they all ask the same questions. Mine might be a little more comprehensive based on what I do because my recommendations are not just based on therapeutic treatments. I might refer them to a neurologist or sleep specialist, or, a medical provider. You might need to go get a physical examination. I don't just provide like, hey, you need to get therapy and do this and exercise and eat healthy. I literally have just tailored recommendations based on that person, their background, and then the results from their evaluation. So that's why I take it a step further because I'm combining that medical health and psychological aspect. I'm combining them together to make sure they can have the best type of treatment and, be able to manage their problems.
Well, I think it gives people hope if you can narrow into some of the root causes. Because
Yeah,
people
root
really
cause
do,
too.
really, people really, and I like what you said about, something that could have happened at a certain age or certain time frame that you thought you were fine comes back to bite you later. And, just from you know, my practice, hypnosis, past life regression, everything is stored in that storage vault, right?
Hmm.
So it's like 90% is your subconscious, 10% is your conscious. And so we might think we're living in our conscious, but we're living off of the cycle of the wheel that's in our subconscious. And so something can externally happen or something that's said, and you have no clue why something just triggered you. And then you
Hmm.
have a whole cascade of physiological responses because the brain doesn't know the difference between the now in the current moment that you're safe to what actually occurred. And so I
Exactly.
am sure you are able to really dig in there and kind of pinpoint, hey, we could go all the way back to such and such. You don't remember this, but something happened around this time frame that triggered, you know, this whole litany of things going on to your now moment. And
Mm-hmm.
then we can also go into this, and that test, and then we can get you into a better therapy or a better medication or something that repatterns and gives them hope that, oh, wow, I had no clue.
Exactly. Hit it on the nail again.
Well,
I mean,
I live and breathe this stuff. I don't have
mm-hmm.
the degrees that you have. I have some certifications and some things, but I know some people are like, what do you want to call it? Registered behavioral technicians. And
Mm-hmm.
I'm more of like a non-registered observer.
Observer.
And I'm
Yeah.
not necessarily a technician, but internally I pick up things
You
and it
do.
tells me a lot. I know, right? That's how we
Mm-hmm.
first
You
met.
do.
And
Mm-hmm.
it tells me it's like this whole other vocabulary system that translates information to me. So when I get into stuff like what we're talking about, which is why you and I just gravitated, like boom, we were in this conversation in 10 minutes of meeting each other.
Mm-hmm.
And
Right.
I just know stuff, but there are people out here that are truly suffering from all kinds of things. And then also, I think we live in a happy world of wanting to be diagnosed. We want something to be the cause of why we are the way we are too. So people have these addictions to, well, I'm this, therefore that's why I do that. I
That's
have
true.
tons of people that I know, oh, this happened to me, and therefore that's why I'm the way I am today. Or I have this diagnosis, and that's why I'm the way I am. But what are you actually doing about it to be a better person? To either
Very
overcome
true.
it or ride it in a way that doesn't hinder you being more of your authentic, fulfilled self in the life that you came here to live. So
Mm-hmm.
when we hide behind all of these diagnoses and all of these things, and we I think we lose faith in who we are as well because we're looking to put ourselves behind some label. What do you think about that?
I think it's interesting you say that because those that I've worked with is either a stigma of being labeled, like I don't want to be labeled. This is something I deal with. It's not who I am. But then some like the label because they internally understand, like what you said, well, I'm this, that's why I act like this. Some people need to know that. They need to know why they're acting the way they're acting. And maybe that label to them is a badge of honor because now I found out what's wrong with me, but they're trying to fix it. But then there's people like you said, they just use the label and it's like, okay, you know what you are, you know why you act the way that you act. What are you going to do about it? Are you just going to go through society using it as an excuse to be able to get out of things? Or to be able to shame those who say something to you and you're like, hey, you can't say that to me because I'm this. And I've seen that. I've no kidding seen that with a celebrity. I'm not going to say their name. I've seen it with a celebrity on a podcast that self-diagnosed themselves, never went and got evaluated, but based on what they researched and talking to experts, I've been living with this as a child. And then people, badge me in public about how I am, the way I act, and not being the best communicator or being too direct. But this is what I have. And the podcast host directly asked, have you been diagnosed? And the person said no. So it was kind of like crickets, like, okay, so you've never been diagnosed, but you're yelling at the world for them attacking you for something they didn't know about. And we still don't know about because you were never definitively diagnosed.
Mm-hmm.
So it's like I see people use it as an excuse. I see some people understand what the label is so they can get the proper treatment. And then I see somebody that is like, all right, you can evaluate me. And I've had this happen too. You can evaluate me, but don't put my diagnosis in the evaluation. And I was like, where do you want me to put them? Don't put them in. So I had a
In
separate
the
copy
cloud.
for my records in the cloud. I had one for my records. And then I had one for that person because I think it would have triggered them if they saw it. And to me, I thought that was interesting because the results were actually, I mean, good. It was a high IQ, very high IQ, um, and nothing alarming. But I think the pressure of seeing that would have triggered them and they didn't want to see it. So I respected their wishes and I kept the copy and gave them one without the diagnosis because they didn't want the label. So,
So if when someone comes to you and they've done, you've done all these tests and you kind of narrow it down more definitively on a medical level, and they can get on whatever protocol is necessary to assist them. Do you find that you see a little more lights coming on in their energy fields, in their eyes? Do you feel like they sleep better? The confidence level goes up. Different meters begin to adjust themselves emotionally, mentally, physically. They're not carrying themselves so heavily. Maybe speaking a little lighter and brighter. Do you find that getting to closer to that root cause or whatever created this cascade, do you find that you see these things getting uplifted?
you know what? I do. I do see the light and load by the time we do the feedback session. A lot of the times they don't understand the evaluation because it's so comprehensive. And I break it down. That's why we have those sessions. I go line by line, tell them the results, tell them what they did and why, and then go over the summary. When I'm done with that, you can see like the heavy heart is lifted because it's like, I understand this. Thank you for, interpreting this for me. Then I see some that are sad because they pretty much figured the diagnosis is what the diagnosis is going to be, and they're kind of sad about it. At least they know, but it doesn't make them feel happy that that was the case. I guess the fear of knowing, it's like I don't want to know, but I do. And now I do know and I have to live with it. And that's for those who I've worked with that had like personality disorders. I mean, some people with ADHD, I've done a lot of ADHD cases. They pretty much know they have it. And then it's like, I kind of needed to know because I need to know how to go about my life. I need to know the right treatment recommendations, if I need to be on medication or can I do a combination of medication and therapy. But the ones with the personality disorders, because you can't treat a personality disorder, you can only treat the symptoms that comes with a personality disorder. So they're like, I'm living with this for the rest of my life. Well, I mean, technically, yes, if you manage the symptoms, you can have the best life you can have. But it's just based on other factors. Like if they have a personality disorder and then they have like PTSD, or if they have major depression, like a long history, it's kind of difficult to manage personality issues when you have severe mental illness that you're trying to manage as well. That's going to affect your personality traits and make things worse, especially depending on what type of disorder it is. So when I see them for the last time, a lot of them are very grateful and thankful that I was able to explain. It makes a lot of sense. Or even those who come in thinking they had one thing and it was something else. It makes sense in the end and they can understand why I came to the conclusion that I came to. So.
Yeah, and I think that a lot of people want to know, and then there's a lot of people equal to that, if not
Mhm.
greater, that prefer to be in the ignorance. And I think that's where that ignorance is, they call it ignorance is bliss. I don't think
Right.
there's anything blissful about being ignorant at all. I never understood that statement. Just doesn't make any sense. But once you find out something, no matter what that something is, then it generally requires taking action.
It
And most
does.
people don't want to take action because that then requires change, and that requires repatterning. And people don't want to do that. They like being stuck in their ways, and some will complain about it to the day they die. And I really have to admire the ones that actually are like, you know what, I'm inquisitive, I'm curious, I want to know.
Mhm.
And then how do I make this better? And then what action steps do I take? And then how can I be consistent and be accountable? We just had a pre-talk about this. and be
Mhm.
responsible for me as a human, because me as a human not being the best that I can possibly be means I am not living up to my God source contract that I came in to be. So therefore, I
Mhm.
cannot meet other people and be in the place that I was intended to be mentally, physically, emotionally, etc.
Agreed.
And so that's my philosophy. So when I see people that, "Oh, I don't really want to know. I want to blame it on this, or I want to self-medicate, self-diagnose, or ignore it." I'm just jaw dropped at how most people will live their life just like that.
Exactly. And those that I work with, even if it's not a reason for themselves, it's a reason for some type of improvement. Like I've had some like, I'm just getting this evaluation because I don't want my spouse to divorce me. I want to better our relationship. And they said, look, something's going on with you. I don't know what it is. If you don't get evaluated, I've dealt with that. Or to better relationships with their children or their parents. They know there's something going on with them, or maybe someone has said it to them and they want to have additional information. And then in the end, it comes out that they want to better themselves. They come in, this is the reason why I want to do it. And then by the end, when they find out what's really going on with them, it's kind of like, yeah, I want to do better. I want to be better for myself too. And those are the things that I do love. Like, it's okay to come in and do this evaluation for someone that you love. But if you come out in the end wanting to change for yourself and that person, it's a double win because you're more likely to make those changes if you're doing it for you and not just doing it for someone else.
Right. And you're doing it for you, and then you will take action with whatever that is. Because lots of times when you make changes within yourself, the people that have surround you are not the people that are supposed to be there. And so you have to be able
That's
to
true
take the
too.
action steps
That's true
to
too.
say, you know what, I have to dissolve this relationship. Could be job, it could be with your kids, it could be with a spouse, it could be with your demographics, it could be with your clothes in your closet, it could be your relationship with anything has to change. But I find that many people live partially connected to who they truly are, and they're accustomed to it. And you know what? You wouldn't take a lamp and semi plug it into the wall and just let it flicker when it needs to flicker. No, you would anchor it in there and make sure it was solid. So when you need it or don't need it, you have full control over it. And I think that's what we need to step up and be about ourselves, and connect the mind and the heart and all the cells in between, and unite them as one, and be fully connected to be the best positive version of ourselves for who we are, not for anyone around us.
So true.
So,
So true.
you know, I'm afraid to come into your office because you'd be like, check, 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 check.
No judgment here. I
X.
always say that in the beginning, no judgment. And that's another thing too. What I like people who feel like I can relate to them because you know, they, they want to see credentials, right? Because they want to know who
Sure.
they're going to is legitimate. But then when they see that, they think that I'm not approachable until they meet me, especially veterans. When they find out that I'm a veteran and they'll say something, I'm like, oh, yeah. Have you been here? Because I was there. And they're like, oh, she's a vet. And then they're so comfortable. And that's the best situation to have because when you're comfortable with me, I can get all the information I need from you to help you.
Mm-hmm.
And that's what's so important. And I feel like some people who may be hesitant to come in and do the evaluation might be totally in by the end of the process with me. And it's based on what you just said. You don't want to do anything half-ass plug in a lamp into the plug-in. No, like some people come in there half-ass, like,
Yeah.
I don't really want to do this, but I know I need to do it. And then by the end, they're grateful that they did it, especially if the process, you know, is comfortable for them. And that's
Yeah.
what I always ensure that they're comfortable. If they don't feel comfortable doing anything, but it's important that they do it, I'll talk to them, but I'll never force anybody to do something they don't want to do or
Yeah.
share information that they don't want to share. But the more information you share, the more that we can get a good sight on what type of testing that you need so we can help you. So
I remember, back, before 2020 when I got, life coaching certifications and a couple other things. And I decided I think I want to do FaceTime or Zoom or some kind of online meetings. And I had people who were highly credentialed in some of the things that I was doing going, oh no, you have to have them in front of you. You have to. And I went, no, I kind of like having the Zoom because now they're in the privacy of their own home. They can
Mhm.
relax, they can breathe, they can tell me things. And then they're not in the bright lights. They're not having me stare them down.
Right.
They're not
Mhm.
looking at me thinking I'm judging them.
Right.
They're in a relaxed state. And then if we need to do any hypnosis or meditation or breathing techniques, they're more than likely to get into that calmer state of homeostasis and parasympathetic. And when you can get someone like that, I think you have, well, I mean, clinically, and you can get into so many more pathways when someone's in that relaxed, trusting, safe space. And
Exactly.
so, do you do a lot of your appointments? I know many of it has to be, of course, in person, but do you do some of your follow-ups or so on in Zoom? Which, by the way, let me bring you back to let me finish what I was saying. I
Okay.
took so much scrutiny from people, but I'm not an easily influenced person. So I would say, I know you have a lot of credentials and behind your name. You do what you need to do. I'll do what I need to do. And I got such great results. And then, of course, 2020 hit and people still needed some sort of therapeutic releasing or um, touching someone else, for whatever reason, um, therapy or breathing or those kinds of things. They found their
Mhm.
way through Zoom and then they started to praise it. And I'm like, well, I did that 5 years
Mm.
ago. Where the hell were you? I'm sorry, I'm a
Right,
forward
right.
thinker. I'm one of those like pioneer people. I like think
Yeah.
ahead and spirit will literally show it to me in a movie. And then I just know instinctively that's what I'm going to do. So back to my thing
Mhm.
with you. Do you sometimes see people via Zoom or do you do sometimes they're like um in their introduction, their first session to kind of get to know you, decide if they're a candidate to come in and see you in your office?
So when I started training in psychology, it was actually during the pandemic, which was very interesting because in training as an extern and a pre-doctoral intern, I had to do my therapy all virtually. Like I started out initially in person, but then we literally had to do it virtually. And so when I started doing the testing, um, I actually had psychometrists that did the testing in person, and I would do the interviews and feedback sessions virtually. Then I took a break, and now I'm back up and running. My office is going to be open next week. So I plan to do either or. If they want to come in and do it in person, we can do it in person. If they want to do it virtually, we can do it virtually, but the testing has to be done in person, though. That's the thing
Yes.
that's mandated. But I find that people are more comfortable doing the initial interview virtually because of the same things that you just said. They're going to be sharing a whole lot of information with me, a lot of it probably shameful to them or embarrassing, or they don't want to share it. And people don't like to be like close to you when, especially the questions that I ask too, because I ask a lot of personal questions just to get the most information I need for testing. But I find that they do really get uncomfortable. And like you said, they might think you're judging them. I'm not judging. I just need the information down, so I can help you. But a lot of them will say, I'm glad that you offered this virtually because I didn't want to come in. But by the feedback session, they're okay whether I do it in person or virtually. But
Mm-hmm.
I think I would rather keep it that way to make them comfortable. And then when they see me for testing, maybe they'll feel even more comfortable knowing like, hey, well, we did the interview. We don't have to think about that. Now I'm just seeing you, in person to do the testing. So
Well, I think you also have to see if they're a candidate for, uh, anything further than an initial, say, virtual setup. And
right.
ultimately it has to be their decision. Sometimes people get in front of you and I mean, not just you, but in general, they'll get in front of people, but they're a little more of that passive aggressive personality. So they'll
Hmm.
passively say, oh, you okay, and then they don't follow through with the rest of it. But when you're on Zoom and things like that, I think virtually people they can make better decisions that work for them because they're
Mm-hmm.
not put on the spot when
Right.
they're physically in front of someone. They can say, let me think
Right.
about that for a little bit. And then they could sign
Mm-hmm.
off and never look at that person again. Or they could say, I need to get back to them, you know? And I also think too, with most people, at least that I know, who have had some sort of challenges mentally for whatever reason, um, I have to be much more conscientious of the energetics of their anxiety and their nervous system
Mm-hmm.
and how I present myself or how I hold my energy when we're in the same physical space. And so I think doing it virtually sometimes removes a little bit of that, you
Yes.
know, that,
Especially with dealing with teenagers and young kids.
yes.
They're very shy. Um, a lot of them don't want to open up. And then the key with them too is like asking them questions in front of their parents.
Mm-hmm.
I've had plenty of conversations with that with my supervisor about, dealing with teenagers that have to tell me things, but don't want to say them in front of their parents. So I would kindly ask their parents to leave for a few minutes and then come back because what they may not feel comfortable telling anyway, they might do it if they're alone versus having people in the room. So there's definitely different dynamics towards doing it virtually than in person. But I actually prefer the interviews to be virtually just to make sure that they're comfortable.
Yeah, because they have to ultimately make the commitment
Right.
to take it the step further. Well,
Right.
we could sit here and talk about this all daggone day.
I know, right?
I mean, you and I, boom, 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 and I'm sure the viewers are going to feel it, see it, sense it, and want more. So, I'd love to have you back on.
No problem at all. I'd love to come back.
Yeah, and everybody, we're going to have Dr. Monique's links in the description so that you can follow her on Instagram and you can get to her website, find out a little bit more about her. You can also go back to the intro video that I'll have on YouTube and on the podcast channels. In the meantime, again, I just ask each and every one of you just to take a moment to boom, like it and subscribe to it and leave us a comment. You may have a question that we could answer on the next episode. So, Dr. Monique, is there anything else you want to share with the audience, or shall we say sayonara?
Sarnara. No, it's certainly been a pleasure. Thank you again for having me. And again, like you said, please put any questions in the comments. Be happy to answer them. So,
Yes, yes. And then we could build upon that for the next show because I
sure.
know we want to talk about some things with kids and ADD and so on and so forth and supplements and so on that you and I mentioned. And there's so many other topics we're going to get into for sure because I think people want to hear this and they need to hear it to sort of broaden their views and understanding of these topics. All right,
Oh,
everybody,
certainly.
keep it spiritually simple and we'll see you on the next video. Bye, Dr. Monique.
Bye.